The parts of a nail are: this is the proximal nail fold, this is the cuticle, this is the white portion is the lunule, this is the nail plate, underneath is the nail bed. These are the lateral nail folds. Here we see the Lindsay nail in this patient, which is also called as half and half nail. The proximal portion is white and the distal portion is pink or brown in color with a well demarcated line of separation between them. This is seen in conditions like chronic kidney disease due to uremia and also seen in cirrhosis of liver. Here we can also see the spoon shaped nails, that is koilonychia in this patient. The most common cause for koilonychia is iron deficiency anemia. Here we see the black nails in this patient. The causes for black nails are Peutz-Jeghers syndrome, Cushing's disease and Addison's disease. See the clubbing in this patient. We have to observe the nails in a tangential direction. Here we see the bulbous enlargement of the distal phalanx. Distal portion of the phalanx is enlarged. This is due to subungual soft tissue deposition. The clubbing is defined as soft tissue deposition in the subungual area due to resulting in the bulbous enlargement of the distal portion of the phalanx. Here we see the Scamroth sign in the patients with clubbing. Scamroth sign is when the dorsum of the two fingers are approximated, generally there is a gap, a diamond shaped gap is seen. But due to bulbous enlargement of the distal phalanx, the gap is obliterated. Normally there is an angle called Lowe-Bond angle, which is 160 degrees between the nail and the nail bed. That 160 degrees Lowe-Bond angle is obliterated in cases of clubbing. There are various grades of clubbing. The grade 1 is obliteration of the Lowe-Bond angle and positive fluctuation. Grade 2 is parrot beak appearance. And grade 3 is drumstick appearance. Grade 4 is hypertrophic osteoarthropathy. Hypertrophic osteoarthropathy is subperiosteal newborn formation. It is a painful condition. It is commonly seen in the joints like wrist, ankle, knee. The common causes for hypertrophic osteoarthropathy are the first one is bronchogenic carcinoma, cystic fibrosis, neurofibroma and AV malformations. In these conditions we see the hypertrophic osteoarthropathy. Generally the time required for the clubbing to develop is about 2 to 3 weeks, and the first finger where we observe the clubbing is the index finger. In the index finger we observe the clubbing first. Then there are various theories for the clubbing. The first theory is the neurogenic theory. It says that due to vagal stimulation resulting in the vasodilatation results in the clubbing. The second theory is humoral theory. The various hormones like growth hormone, estrogen, bradykinins, prostaglandins causes vasodilatation and result in clubbing. The other theory is the PDGF, that is platelet derived growth factor theory, which says that due to any infection in the body, the platelet derived growth factor is released and causes bulbous enlargement of the distal phalanx due to subungual soft tissue deposition. This is widely accepted theory. PDGF theory is a widely accepted theory. Other theories like the hypoxic theory. In hypoxic theory, due to persistent hypoxia, there is opening up of the AV anastomosis under the nail beds, resulting in the clubbing. The other theory is ferritin theory. In ferritin theory, the increased levels of the ferritin in the circulation causes dilatation of the AV anastomosis, resulting in the clubbing. These are the various theories of clubbing. Now we see the various causes for clubbing. The clubbing can be congenital or familial. There is a condition called congenital hypertrophic pulmonary osteoarthropathy, pachydermo-periosteosis. In this condition, in children we see the clubbing. It is congenital or familial in nature. There are various systemic causes for clubbing. The respiratory causes like cystic fibrosis, bronchogenic carcinoma, bronchiectasis, and other suppurative lung disorders, lung abscess, and we see the clubbing. Serious causes, there is cardiovascular causes of clubbing are Eisenmenger syndrome, subacute infective endocarditis, atrial myxomas, cyanotic congenital heart diseases. We see the clubbing. The gastrointestinal causes of clubbing are cirrhosis of liver. Other causes are Crohn's disease, ulcerative colitis. There is a condition called pseudoclubbing. in hyperparathyroidism due to resorption in the nail bed. We see the clubbing, pseudo clubbing, and also in Hansen's disease, vinyl chloride workers, we see the pseudo clubbing. There is an entity called differential clubbing. Differential clubbing means clubbing seen only in the lower limbs. This is seen in condition like PD, that is patent ductus arteriosus with reversal of shunt. These are the various causes, various systemic causes for the clubbing. Other different nails in clinical medicine are plumber's nails. They are also called rat-bitten nails. This is due to onycholysis. It is seen in conditions like hypothyroidism, hyperthyroidism, and drugs like doxycycline, chlortetracycline, chloramphenicol causes plumber nails. The other type of nail is terry nail, also called white nail. It is seen in conditions like cirrhosis of liver, hypoalbuminemia, and diabetes mellitus, congestive heart failure. Next type of nail is red nail. This is seen in congestive heart failure. Other nails are blue nails. This is seen in Wilson's disease and due to silver deposits. Blue nails are seen. Yellow nail syndrome. Yellow nail syndrome is yellowish nails in the fingers and the toes associated with clubbing and onycholysis. This is called yellow nail syndrome. Bues ridges or Bues lines. These are the transverse ridges on the nail plate. This is due to temporary alteration in the nail growth. This is due to temporary alteration in the nail growth. Bues lines are seen on the nail plate. It is seen in conditions like pneumonia, pulmonary infarction, myocardial infarction, and exanthem fevers like measles, mumps. These are the different types of nails we see in the clinical medicine.